question. Carter, chime in if you would. Effective treatments, additional effective treatments for chronic pain. When you think about the patients that you've helped treat,
Yeah.
what seem to work more than others? Are there any that seem to work better than others?
Well, just piggybacking off what Christian was talking about, a lot of what he's describing is making sure that the patient and the people are being heard. I
Yeah.
think in our culture, it's people who have chronic pain and don't have, a very easy to assess diagnosis. Sometimes they have to put in extra labor within the healthcare system to get the satisfactory care that they need. We talked about the holistic care. We talked about culturally competent care. That just adds an extra layer on getting to a successful treatment plan for people. Everyone's plan can and should look different, right? It should be very individualized to treat the chronic pain that you have, the chronic pain that you are experiencing at that moment. And we know that it does change. So like Christian said, those reassessments. And I think providing options for people, right? It doesn't all look the same. It's not a cookie cutter approach to fix someone's back pain. Arthritis, it's not a cookie cutter approach. It could be a mix of medications. It could be a lifestyle change. It could be a dietary change. And like you said about with the running, Michael, understanding that chronic pain can change one's day-to-day routine, right? It can be debilitating to some. It can be uncomfortable for others. And I think from healthcare standpoint, we need to understand that and hear the patients and hear the people.
Yeah, I really appreciate that. It's taking me back. And I remember hearing from my doctor that I wouldn't run again. At first, in the short term, it was a little depressing for me. And then I realized there are other ways to get that cardio in. Even running on a treadmill was a lot better than what I was doing. Hitting that pavement, that hard pavement, had to stop. So I switched in the short term to a treadmill. So I appreciate both of those perspectives, you guys. I'm wondering about the treatment of chronic pain and mental health. Should they be attacked simultaneously, or do you think it would be best to hit the pain first to try to alleviate the mental health, the potential outcome? Or since it's so cyclical, should or could one be addressed before the other? Do you attack them both at the same time? Do you have any perspectives on that? Maybe Christian, with you, if you could start.
Yeah, that's an excellent question. I think that continues to roll over amongst it in the healthcare profession. For mental health clinicians, when a patient is initially seen, common practice is to rule out any biological and physical complications that may be exacerbating or significantly really impairing their reported mental health symptoms. For example, if a parent brings a child into the clinic, right, and it reports somatic symptoms, irritability, loss of appetite, moodiness, angry outbursts, before diagnosing him or her with, for example, disruptive mood dysregulation disorder or ADHD or oppositional defiant ODD, that child really should be referred to a primary care doctor to rule out any pre-existing biological or physical issues, and avoid misdiagnosing a child, right? Because many times, as you know, Michael, many times a child is labeled with a diagnosis that sticks with them throughout their childhood, all because the child was not thoroughly assessed and really examined through coordination of care, which is that doctor and that mental health professional. So through mental health assessments and blood tests from the doctor and constant progress reports, it's much more effective to treat chronic pain and mental health symptoms. But with that being said, it is also key that both managed care and doctor specialists are in coordination with mental health providers to work together really on a comprehensive treatment plan. So the treatment isn't really going in circles and not getting anywhere and not making any progress.
Wow. Any perspective on that, Carter? Anything you want to add? You're nodding, so you agree.
Yeah,
I think
Christian, he's a wealth of knowledge, man. It sounds
really
like he's like you said, he is knee deep in this arena, and I'm learning a lot from him. And for me, it's like you can't really separate the two. You can't treat one without the other. I feel like for the best optimum care in a perfect world, you would be doing both simultaneously. I know that's not necessarily feasible in a 30-minute or 45-minute window in a doctor's office, but maybe that's the model we should be aiming for, right? And as we get better and we learn more about chronic pain and how it impacts people, we try to attack both at the same time.
It's interesting because just as a brief segue before we get into that next question, I'm remembering now going back to when I thought I was being treated for pain. So, and you talked about headaches. Headaches were going on. I had that pain in my foot. And I wound up in my doctor's office, and I'll never forget, and this was a medical doctor's office. My doctor said, have you thought about talking to a therapist? And I first did a double take, and I was like, a therapist? Man, my foot hurts and my head hurts. What are you talking about? And he said, Mike, I really think that this is tied to something else. You got the other things going on. And man, he knocked that out of the park, because once I made that shift and started addressing the mental health issues first, the headaches went away, completely went away. Other than seasonal allergies, I don't suffer from those anymore. So I'm remembering, you're right, they're so linked. And sometimes the symptoms of one shows up like the other, or you might think it might be the other. So this is really a fascinating conversation for me, you guys. Let me ask you this, and this is the part of me. We're all a kind of instantaneous culture. I call it a microwave culture. We want everything right now. I want to be able to take a pill and feel better. How soon after I start treating that chronic pain, given someone has them both and they're tied together, roughly, and I know you can't say, Carter, I know every patient is different, every case is different, but is there a reasonable general period of time after which you could start to see some mental health benefits after you start treating that chronic pain?
From my experience, like you said with the headaches, it can be very quick. I work with a handful of people who suffer from chronic migraine. You know, they get the injections, they take the medications, and when you are around people who haven't had that migraine or have that release, it can be instantaneous. You wake up that morning and I don't have the headache today, and
Wow.
I can feel better. Now, you know, completely relieved or completely back at your baseline, that could take some more time. And I think Christian will talk more about that. But, you know, just the ability to wake up and go through your day and not have it, even if it's just for a day or for a part of the day, I think that can be instantaneous.
Wow. Christian, what you got? Knock it out of the park for us. Is Carter right? Have you seen that? You're nodding.
He's on point. Yeah, he's on point with that.
Y'all are both nodding when the other's talking. So talk to us.
Yeah, he's preaching, because he mentioned that baseline component, and really due to how the current delivery system and healthcare structure is set up, you know, with the waiting list, follow-up appointments, assessment times, we have to account for the time it's going to take to actually pinpoint the root cause, right? So one thing to think about is the idea of diagnostic overshadowing. And that's the idea that when individuals, for example, with a serious mental health condition, go to the emergency room or go to a primary care location, talk to primary care providers, oftentimes what's initially noticed or really identified in the mental health piece, they're in the wrong place. So if they're having a mental health condition, they go to an ER room that's set up for physical care. So initially, that's going to add 2 months on to finding the root cause, right? Yeah. So someone with a mental health condition or illness might go to a more physical health related setting, and automatically a lot of their symptoms may be attributed to the mental health diagnosis rather than looking at their physical health concerns, or it's something that is separate from what might be going on with the psychological or emotional. So overall, the recovery times varies by patient due to their biopsychosocial factors, and also those variants determinants. So in treatment, they're receiving through managed care and healthcare specialists. So that baseline really is the key component to really identifying where that patient is. So that's where you want to get them to, is that baseline, and then be able to go from there once you pinpoint the issue.
Wow.